Okay, let's go ahead and get started. Hello and welcome. Thank you for joining us today. Today's webinar, we are going to be discussing the virtual site visit. You may have all remember us talking about the virtual site visit during the 2022 EHDI coordinator meeting. This is a bit of a follow-up from that meeting with just some additional details and experiences since it's been tested more and more since the 2022 EHDI coordinator meeting. So the way that we're doing this webinar a little bit differently than we've done some of our webinars in the past, where the presentation portion of the webinar is actually recorded. And one of the reasons why we did that is we really wanted this video to be a learning tool for all state coordinators as well as their staff to be able to go back, slow down the recording so they really have an opportunity to digest the material. After the webinar recording is over, we will open it up for live question and answers. So make sure that you are putting your questions in the Q&A box that is located at the bottom of your screen, not in the chat box. The chat box should be disabled, but put your questions in the Q&A box. And then after the webinar recording is over, we will all turn our videos back on and answer your questions live. So I also want to just do a quick introduction of all of our presenters. We have a great lineup for you today. There's three main individuals that have been working on the virtual site visit. One is Dr. Randy Gersten, who is an audiologist. Randy does a lot of consulting work for NCHAM, as you probably all know. She's been the big leader in the newborn hearing screening training curriculum, as well as several other programs, including the virtual site visit, or VSV for short. We also have Stacy Jordan, who is also an audiologist, and she's a project coordinator with the Vermont Early Hearing Detection and Intervention Program. And Stacy has also worked on several contract projects with NCHAM, and we appreciate her bringing her expertise to the table as well. And then last but not least, we also have Dr. Ginger Mullen, who is an audiologist as well, and she is the EHDI coordinator for the state of Illinois. I'm sure you all are very familiar with Ginger. She's done a lot of presentations over the years nationally around pediatric assessment, amplification, coordinated parent professional partnerships, and a lot of other EHDI related topics. So without further ado, I am going to go ahead and stop the screen share and start the video. So bear with me for just a minute as I get this queued up.
Allison, this is Ginger. I know that we're going to be shutting the chat off in about 5 minutes, but is it okay if everybody inserts their name and where they're from for the first few minutes?
Yes, thank you for that reminder, Ginger.
Right, everybody.
Hello, everyone. My name is Randy Winston Gerson. Myself, along with my colleagues, Stacy Jordan and Ginger Mullen, are excited to present this webinar to you on how to implement the virtual site visit program, which we refer to as the VSV. Today, we will take a closer look at each of the components of this program and walk you through each step. The Newborn Hearing Screening Virtual Site Visit Program was created through CARES Act funding to address the challenge of state EHDI programs not being able to conduct hospital site visits during COVID and to address the potential fallout to hospital program quality as a result. During its development, we recognized the potential of the VSV program in benefiting EHDI and hospital program quality on an ongoing basis. It not only addresses the need from fallout from the pandemic and continuous COVID challenges, but from constant staff turnover in birth facilities and EHDI state programs. It sets the table for continuous program improvement and sustainability in the future. Its benefits go so far beyond a temporary solution. The VSV offers a mechanism for ongoing communication, collaboration, education, training, and knowledge about best practices and the standard of care in one complete package. Any program staff can walk into a new position and have access to the tools and resources they need to be educated on the standard of care. Some of the great features of the program include the self-directed step-by-step approach, which we will cover in detail in a moment, the ability to collect data on the policies, procedures, and protocols of the hospitals you work with, the collaborative relationship building approach to help you build a foundation and get to know your hospital partners, and flexibility in how you choose to use it. Although we encourage states to follow the VSV program in its entirety, it can be used and adapted to meet the individual needs of your state and what works best for you. We provide a comprehensive guidebook, which contains all of the instructions for conducting a virtual site visit, along with email templates, sample agendas, a glossary, the parent-developed support material, and Strata user manuals for both the EHDI program and the birth facility. There may be various considerations when determining which hospitals you want to work with. We recommend you start small. So you may want to start with a hospital you know will be easy to work with and willing to work with you. This will afford you the opportunity to go through the process with ease and roll it out from there. Eventually, you can have multiple hospitals rolling at the same time. The VSV learning community found that after you go through the guidebook once in its entirety, it is easy to do and much less daunting. Finally, although the design of this program is virtual in nature, meetings can be conducted in person or virtually as a program sees fit. Before we start going through the steps, I'd like to turn it over to Ginger Mullen, who will review how the VSV program fits into the HRSA EHDI funding opportunity goals and objectives.
Hello. As part of the EHDI system, you may receive funding through one of our federal partners. The Health Resources and Services Administration supports all states and jurisdictions to improve their EHDI systems through innovative, scalable, and sustainable work. Today, we're going to review some of the language in the Notice of Funding Opportunity, or NOFO, that supports your state implementing the Virtual Site Visit Program and the associated tools. Each of the following slides will show the language from the cited NOFO, the page on which the information occurs, and the key concept that your team can meet. The Virtual Site Visit Program can address screening practices, screening rates, messaging to parents, scheduling of outpatient appointments that support outpatient diagnostic follow-up, educating and partnering with stakeholders, using continuous quality improvement, and supporting evidence-based websites for the sharing of education and improvement tools. Under program objectives, states are encouraged to sustain or improve screening no later than 1 month of age. The VSV clearly addresses that best practices for the objective of screening and uniform follow-up. The next program objective of completing diagnostic evaluations no later than 3 months of age is addressed through parent messaging, maximizing hospital or community resources, scheduling appointments prior to discharge, utilizing EHDI PALs, and promoting the Joint Committee on Infant Hearing's best practices. The third program objective is around training health professionals and service providers trained on the key aspects of the EHDI program. The VSV is a collaborative process with associated training tools that has reach from screeners through administration and out to the follow-up providers. Each recipient of HRSA funding is also expected to address numerous activities. On page 10 of the NOFO, it requires the state and territories to partner for referrals, training, and information sharing with a variety of stakeholders, including birthing centers. The nature of the VSV is to create a collaborative and reflective partnership that can use the program to subsequently, subjectively, and objectively evaluate partnerships, processes, and outcomes. On page 11, item 6, it is a continuation of the previous idea of monitoring and assessing performance and identifying any gaps or challenges. The VSV culminates in identifying opportunities for improvement for each facility. The improvement then may be addressed using the quality improvement methodology or the Plan, Do, Study, Act methodology, for which states are very familiar. Finally, on page 11, number 7 is an activity that you can initiate by next Tuesday. Each state or territory can link to the VSV program and the associated tools. This information is posted currently on the infanthearing.org website, and it can improve or expand your state or territory's EHDI website easily. Programs can link to the related tools for the VSV program, or EHDI PALS, or the Newborn Hearing Screening Training Curriculum. The links for these, as well as descriptive paragraphs, were shared at the 2022 EHDI Coordinator meeting and can be shared again with your team so that you can easily implement this activity by next Tuesday.
So now I will conduct an overview of the guidebook, walk you through step by step, and share the many templates and resources that were developed. We broke down a site visit into 8 intuitive steps or manageable chunks that, when completed, would give us the overall outcomes we want to achieve. In step 1, you will need to identify a birth facility or facilities. In step 2, you will make contact with that birth facility. In step 3, you will prepare for the initial virtual meeting. In step 4, you will conduct the meeting and lay the groundwork for the weeks to come. In step 5, you will conduct the information gathering process. In step 6, we summarize all of the information we've gathered and prepare to present it to the facility. In step 7, we have another virtual meeting to discuss the findings and to determine next steps. And in step 8, we send out a thank you email with the summary documentation, resources, minutes, etc. The flow we've created covers an 8-week span. However, as you go through it, you may find a timeline that works better for you. Regardless of the number of weeks in your timeline, we recommend setting up the dates for both the virtual and final virtual meetings early on and plan from there using a sequential approach so the steps and activities flow from one to the next to keep things moving forward. You will also want to decide whom within the EHDI program will be the lead and who will be working on the project. As each of the steps are self-directed and straightforward, other program staff could provide assistance. For example, a parent professional that has experience working with hospitals or in other related EHDI projects and other EHDI program staff might conduct the correspondence and information gathering activities to help support the EHDI coordinator in preparation for the virtual meetings. Where the EHDI coordinator can make the greatest impact is by reviewing the results of the information gathering process in step 6 and attending both of the virtual meetings, which are steps 4 and 7. We highly recommend that the EHDI coordinator and a parent leader or partner attend virtual meetings. The importance of the parent role in providing the parent perspective in support of the initiative cannot be emphasized enough. It reinforces how important it is for the birth facility to provide the highest possible standard of care to babies and families. Later in this webinar, we show you the Parent Story Builder tool created by the parent partners during the development of the VSV, which can be a great tool for this meeting. You may also want to keep track of when you've initiated a virtual site visit so your data manager can establish a baseline and monitor your EHDI program outcomes. This program is an opportunity to help you meet the goals and objectives in your grants. Now I will go through each step, breaking down the activities and all of the supporting materials that will help this make sense. Step 1. It's broken into 2 parts. As I mentioned before, consider picking hospitals that are easy to collaborate with and who are generally responsive. After you have completed your first successful virtual site visit, you may decide to prioritize according to their performance and outcomes. For example, focusing on those who consistently have excessively high refer rates or are in small communities where there's lots of staff turnover and low follow-up rates. You'll send out an email to your newborn hearing screening contact at the chosen birth facility and request their participation. There are different approaches to that. Some EHDI programs may take a more relaxed approach, such as asking the hospital if they want to participate, and others may take a more assertive approach. We've prepared email templates for all correspondence. You are welcome to modify with what works best in your community. So as you can see, this template describes the VSV and requests their participation. Alternatively, you can contact the birth facility by phone and use the email as a script. Now we're going to move on to step 1, part 2. After receiving confirmation of participation, you want to identify the key hospital staff stakeholders, decision makers, that can provide information about the inner workings of the program and can help to support program improvement. Together with your hospital contact or liaison, you'll identify who these people are, and utilizing the birth facility contact worksheet, you will fill in their contact information. These are the folks you'll want to include in the virtual meetings. For example, screening coordinators, nurse managers, clinical educators, chief nursing officer, pediatrician, hospital audiologist, stakeholder on the PDF needs to be filled in. Only those that are relevant and working with the screening program. You will also want to identify virtual meeting platforms that the hospital can use and determine a date and a time for the initial virtual site visit collaboration meeting. Here is a quick glance of email template 2 in Appendix 1. Now we are going to move on to step 2. With the contacts you have compiled, you will want to figure out the virtual platform you will be meeting in and send out an email invitation for the meeting with the meeting link. You can also use a doodle poll to coordinate schedules, especially if there are more than a few stakeholders. We provide links to both an email template and a sample agenda. Now let's move on to step 3. The overall goal of step 3 is to prepare for the initial virtual site visit collaboration meeting. As we discussed, you'll be sending out a reminder email and the meeting agenda along with the supporting documents for the meeting, which we'll be discussing next. Prior to the meeting, you'll want to familiarize yourself with these documents. Don't forget to send your EHDI Programs website as an informational resource as well. A big part of this meeting focuses on gaining buy-in and trust by educating the stakeholders about the 136 national goals and the importance of the birth facility's role in meeting those goals. You'll also be discussing the role of the state EHDI program and how, as a team, you work to ensure babies get screened and receive the follow-up they need. You'll have the EHDI 136 roadmap in Appendix 7 to demonstrate the process. We really encourage you to have your camera on and to encourage all participants in the meeting to turn their cameras on. The ability to see one another helps with building rapport reading nonverbal reactions, and cues for when further clarification may be needed. You'll also outline the information gathering process, which include the nurse manager worksheet and the strata reporting database, and recommended timelines for completing each. The nurse manager worksheet in Appendix 4 is a supplemental tool to help the hospital program staff by compiling and documenting all the important details about their program into one document. It contains many of the often undocumented program details that live inside the nurse manager's head. If, for example, there is one staff member that keeps track of everything and then one day is no longer there, the screening program is left scrambling, as we've seen repeatedly throughout the pandemic. The worksheet provides a central place to document key aspects of your newborn hearing screening program that are important in training new staff, with transitions in leadership and that support continuity of care. When completed, this document should be kept in a central place, both hard copy and electronically, for ease of staff access. During the meeting, the hospital will be asked to complete it and submit it back to the EHDI program 1 week prior to the final meeting. Strata reporting will be covered by Stacy Jordan when we get to step 5. The strata reporting database, previously known as the AGGI database, is an easy, intuitive, and straightforward way to gather information about the birth facility's policies, procedures, and protocols. Through this web-based system, the EHDI program sends out templates to the hospital of questions that are called requests, which are categorized into the various newborn hearing screening topics. Topics include audiology oversight, documentation, EHDI data elements, equipment, follow-up, hospital facility profile, medically fragile, screening protocols, training, and hospital contacts. Each request covers a specific topic or area of a newborn hearing screening program. Once the birth facility completes them, the EHDI coordinator will automatically have access to the completed requests. A nice feature in Strata are the informational hover eyes that have been populated with information and resources for the specific question or topic area. This information can highly benefit the birth facility or the EHDI coordinator who may be new or want to learn more about the standard of care. Stacy will point them out during her demonstration. The first time using strata reporting, it may take a little longer, but state programs who have used it have reported it becomes much easier after using it with the first birth facility. Be sure to familiarize yourself with Strata prior to the initial site visit virtual meeting, because as a part of the meeting, you will describe what Strata reporting is and review the request categories and descriptions. Now let's move on to step 4. Step 4 is about the initial virtual site visit collaboration meeting and everything you are trying to accomplish during the meeting. Every detail is outlined with talking points along with the supporting documents we discussed in step 3. We recommend assigning a note taker during both of the meetings. During the meeting, you'll want to discuss a timeline for conducting the strata reporting activities, letting the hospital know that an email will be sent along with everything they'll need to log into Strata and complete the requests. We have provided a scripted description of Strata in the guidebook. It's important to emphasize that the requests can be completed at their own pace. They don't have to be completed in one fell swoop. You will also want to remind them to complete the nurse manager worksheet and submit it back to you a week before the final virtual summary meeting. Finally, before the close of this meeting, determine a date and an alternative date and time for the final virtual meeting. This takes us to step 5 of the VSV guidebook, which focuses on the strata reporting database activities. I'm going to turn it over to Stacy Jordan.
I'm now going to take a few minutes to introduce the strata reporting database. As Randy shared, the Strata reporting database provides a way to gather information about the birth facility's policies, procedures, and protocols at a point in time and over time. We think you'll find Strata to be easy, intuitive, and straightforward once you get used to it. We all know the first time in a new system can take extra time, but we've created a Strata reporting user manual for both the EHDI programs and one for your birth facilities to guide you step by step. I'm now going to provide you with a general overview of the Strata reporting database, logging on using an EHDI account, so you can see how Strata will look when you log in. Each of your programs will get one login and password for your EHDI program to use. Now that I'm logged on, you can see the list of 10 request templates that Randy introduced earlier. Once you log into your EHDI Strata account, you too will see your copy of each of the 10 request templates that the VSV admin have created and populated specifically for your EHDI program to use with your birth facilities. Just to review, these requests are like surveys, each with one or more questions with answer options. There are 10 request templates currently available in Strata. Each request focuses on a specific topic or aspect of a newborn hearing screening program. This orange banner at the top is a menu. I will take a moment to go through each tab or section on the menu briefly. Remember, your manual will walk you through step by step. When you log into Strata, the section that it always opens to is the current request section. As we've already talked about, this section has a list of 10 requests that are ready to be assigned or have already been assigned to your birth facilities. Next is the request management section. This is where the VSV program administrators create and store request templates. At this point in time, this is not a section that you need to be familiar with in order to participate in the VSV program. The next tab is facilities. This is where you add a birth facility or facilities you are going to do a site visit with. You can create accounts for your facilities one by one, or you can set them up all ahead of time before you initiate the site visits. Let's walk through adding a new birth facility. It's super easy and simple to add a new birth facility and create their login and password. Please note that you will be creating the login and password for each of your facilities, and each facility will only get one account. Yes, if the birth facility forgets or loses their account information, you can access this and resend it to them. The first step to adding a new facility is to click on the Add New button. This opens a new window where you will enter information into at least these 3 required fields. First is the name, then the username, and then a password. After I enter these 3 required fields, I will press Save. Now you will see that this new facility is in My Facilities list. When the birth facility logs in, they will use their assigned name and password that you have created for them. So let's go in now and assign the request to this new facility. You will go over to this edit icon pen and click on it. You will then go over to this request menu and proceed to go through and click the 10 available request templates. Then press Save. When this new birth facility logs in, they will see this list of 10 requests ready to be filled out. This looks very similar to the way your account looks when you log in. Once the birth facility responds and submits each request, you will be able to access and review their responses in your account. I will show you what the hospital account view looks like and walk through submitting a request after I describe the last 2 sections on the menu. The next section is called Reports. The Reports section is still being developed. The manual will provide you information about what's currently available. An example of the vision for this section is to provide EHDI programs with reports that measure progress over time for each of the specific topics and for each facility. More is coming in this area, so stay tuned. The last section on the menu is resources. This section is populated by the VSV Program administrator staff with national information and announcements. This section also has space for state EHDI programs to use for sharing your individual state or territory information with your facilities. As Randy mentioned earlier, there is an email template provided in the guidebook for you to send to each of your birth facilities to initiate their strata reporting. The email template will include a space for you to add the facility-specific login and password. I'm going to log out of this EHDI account, and we're going to log in as that new facility to see what their account looks like. So let's take a quick minute to log in as the new birth facility that I just added. So you can see how their account defaults to the current request section, similar to the way your account looks like. And we're going to just walk through one of these for an example. They'll go over here to this pen icon to click on it to submit some of their responses. This opens up to the template with the list of questions and possible answers as we have explained. I do want to take a moment to point out these icons that Randy mentioned earlier. These are available throughout Strata to provide more information on the standard of care and additional links to resources. This is a feature that can benefit the hospital who is answering the requests and may not be familiar with a specific topic. It can also be beneficial to an EHDI coordinator and program staff who may be new or unfamiliar with best practice. So I'm going to go through and just answer all of these questions as if I'm the birth facility, and then press submit. This tells me I've submitted it successfully. As the hospital, I can go down to here and see that it is done. I can also click on this little paper icon to review and print what I've already submitted into the EHDI program. So once the hospital finishes submitting that request, that information is going to be available in your EHDI account. I'm going to now log back in as an EHDI account so you can see what that looks like. Let's go back and take a look. So we'll go down to the screening protocols, and I'm going to click on this icon. And similar to what was in the hospital's ability to view, I can now see I have two responses to the screening protocol, and one of them is this brand new hospital that I entered in today. So to summarize, when you initially request access to participate in the VSV program, your state EHDI program will receive the following Strata reporting database materials: a login and password for your EHDI program, copies of the 10 request templates in your Strata account ready for you to assign to your birth facilities, and the 2 Strata manuals, one for your EHDI program and one for your hospitals to use with step-by-step instructions. Randy will now talk to you about the next steps and how to compile all this great information gathered from Strata and prepare for the summary meeting with your birth facility stakeholders.
Thank you, Stacy. Now we're going to talk about step 6. Step 6 is about preparing for the final virtual meeting, the virtual site visit collaboration summary meeting. It is separated into 4 parts. Parts 1 and 2 are about coordinating logistics for the virtual meeting and sending out the email invitation with the agenda. Part 3 is where all of the work and efforts leading up to this point come together. You'll be compiling and summarizing the program information that the hospital provided in each of the strata requests they filled out. We highly recommend the EHDI coordinator participates in this part of the process, even if you have assigned other parts of the site visit to other program staff. We provide the strata reporting response summary worksheet in Appendix 9, which when completed assists the EHDI program in determining which policies and procedures are current and updated and which will require some updating to reflect the JCIH guidelines. This was created to provide a guideline and a tool to convey program strengths and weaknesses and next steps during the virtual site visit collaboration meeting. Each item has a link for more information and where to reference it in the 2019 guideline. During the meeting, you'll be prioritizing each objective as 1, 2, or 3 with your birth facility partners and determining who will be assigned to each objective. In preparation for this meeting, you'll also complete the EHDI Data Elements Report fillable PDF in Appendix 8 for the previous quarter, which consists of total occurrent births, total screened, total referred, and total not screened as outpatients, and compare it to the data elements request they completed in strata reporting to see if what they submitted is consistent with data in your EHDI-IS. This exercise provides an opportunity to have a discussion during the virtual meeting about monitoring screening program outcome data and how they are doing relative to meeting state reporting expectations. For example, how often do they check their data? Are they meeting national benchmarks? Are they reporting in a timely manner? And are their data submissions complete and comprehensive? Use this as an opportunity to evaluate and discuss the integrity of their routine data submissions, again, focusing on program strengths and areas where improvements may be needed. Additional topics to consider discussing at the meeting and providing tip sheets for are legislation, reporting, state guidelines, policies and procedures, and performance benchmarks. The last part of this step is to send an email reminder with details for the upcoming meeting and attach the meeting agenda. If you haven't already received the completed nurse manager worksheet, you can remind the hospital or birth facility to send it before the meeting. Over the past weeks, you've established a rapport with the key birth facility stakeholders, gained buy-in for EHDI, reinforced the importance of their role in the 136. You've begun building a collaborative partnership and have conveyed the importance of providing the highest standard of care for babies and families. Through the information gathering process you've created, trust and awareness, you reviewed the most important components that comprise a quality screening program, and you've created an opportunity for the birth facility to dust off the cobwebs of their outdated policies and procedures and update them to the most current standard of care. This brings us to step 7, which is about conducting the VSV collaboration summary meeting. Although all identified stakeholders may not be able to attend this final meeting, it's important that the EHDI coordinator and hospital stakeholders are there. A draft agenda has been provided. In this summary meeting, you will bring everything around full circle by summarizing the information they provided, discussing strengths, weaknesses, next steps, and addressing reporting and screening performance data. You'll also want to share the numerous program improvement resources, which are available on the VSV webpage. Included in the talking points is to share information about the JCIH 2019 guidelines, the Newborn Hearing Screening Training Curriculum, NHSTC, as critical program tools for comprehensive competency-based training for all staff and related stakeholders, and EHDI PALS for the follow-up of infants who do not pass the newborn hearing screen. Convey that the NHSTC and EHDI are free of charge, easy and simple to access and use, and can assist them in their program improvement efforts relative to screening and follow-up. We provide a flyer for the NHSTC in your packet of materials, which you can share with the birth facilities. Now I would like to briefly walk you through the VSV webpage on infanthearing.org and show you where the VSV resources are. The VSV webpage essentially provides a summary of the program purpose, goals, and focus, as well as an overview of the steps in the guidebook. It has a portal to Strata reporting, so you can log in via the Strata URL or through this webpage. As you scroll down to the bottom of the page, you will find two folders containing all of the documents we've shared with you from the appendices of the guidebook and more. The one on the left contains resources for EHDI programs, and the one on the right has resources that can benefit hospital programs and the families they serve. We place them on the website as individual PDFs for easy access. You can view them at your leisure, as well as have unlimited access to them. An integral part of the VSV development was the participation of parent partners and their work developing several supporting documents and resources created for use by the EHDI program and birth facilities. All documents were created in both English and Spanish and contain QR codes for additional learning. I will briefly introduce them, but for a more in-depth review and to learn more about their intended use, watch a presentation conducted by Carrie Ballion, which was presented at the 2022 EHDI Conference. The presentation is called Diving Deeper into the VSV Parent Materials. A link directly to the presentation is provided. Carrie describes each document, the rationale behind its development and purpose, who it's intended for, and how state programs can utilize them. The first document is Newborn Hearing Screening Next Steps. Next Steps is an informational handout for families who need follow-up after hospital discharge. Next is What to Expect, Baby Steps. This was developed for prenatal providers to share with families before baby arrives. Next is How to Complete Your Own Family Story. This is a family story builder, which was developed as a tool to help families document and tell their story. Accompanying it is a tip sheet to provide guidance to families while they are in the process of writing their story. Now we're ready to move on to the last step. Step 8 is about sending a thank you email to all VSV participants with any minutes, summaries, and next steps. We also created a certificate of completion template, which is available for EHDI coordinators to provide to the birth facility once they have completed the VSV. It will be included in your packet of materials. This concludes our overview of the VSV Virtual Site Visit Program. We hope it has been helpful. We know a lot has been covered, so feel free to contact us with any questions or interest in participating. Reach out to the VSV program using this email.
Okay, excellent. I hope that the audio and the speed of the play of the video worked well for you. I am going to invite all of our panelists, Ginger and Stacy and Randy, to turn on their cameras. And they are here to answer any questions that you have around the virtual site visit. So please go ahead and type them into the Q&A box. And then we will move forward with getting all of your burning questions answered.
So as folks are typing those, just remember that the shortened version that you just saw will be posted online for your reference or for the reference of any of your colleagues or your staff. I think Randy gets tired of hearing me say, my favorite part of the VSV is the fact that I don't necessarily have to do this project. One of my colleagues in my office can do that, and I can be a go-to person, but I don't necessarily have to work with each individual hospital. So
it has been posted on the VSV website that you just saw in the webinar. And it's in the resources section where you saw the drop down of all the parent materials. And you will have access to it to go through it, pause it, repeat, any section you want to listen to. But we really developed that tool for use after this webinar and over the long term as you move forward in implementing the VSV program in your state.
Okay, so it looks like we have a question that's come in. How long does it typically take to perform the site visit? Hospital staff may want to know how much time the project will take.
We have a recommended timeline. This is Randy. We have a recommended timeline. And the way we set it up is that every step would be sequential over a period of about 8 weeks. But really, and the thinking behind that is so that once the momentum started, it would not be as easy to get off track as if we kept it going for a longer period of time. But it can be modified. The timeline can be modified to meet your needs. So in its entirety, from the very beginning to the very end, from the very first step to the very last step, we estimate that ideally, in a perfect world, it would take about 8 weeks.
Great.
And Randy, this is Ginger. Just to comment, to follow up on that, the individual activities within each of the weeks that folks are asked to do were designed to take as little time as possible. A lot of it depends on if the person you're engaging with knows those answers or if they need to go out to their collaborating partners at the hospital to find some of those things out. So I think that depends on how big your hospital system is, who you have engaged at the table, how much information they know themselves, or how much they need to go back and ask folks. So it really kind of varies. We strongly encourage that you start with one of your superstar hospitals to see how they're doing. And that will kind of give you the least amount of time that it takes to get through the whole process. But any individual activity can be started and stopped at any time. So anything that's in Strata can be saved and come back to. Any of the Word documents, the PDF documents, they can save them and come back to them. So we were very cognizant in that it's a very busy birthing facility and that they may need to go ask questions or they may get pulled away. So some of those activities can start and stop. Randy, does that help at all?
I think it does. And when we developed the VSV, we actually held sessions with hospitals and the folks who were completing the VSV. And what they found in trying to answer these questions is they had to coordinate with other departments like the NICU or an audiologist or somebody else who may have a better idea of what the protocols were for that particular policy and procedure. And so, yes, it often does take coordination. And one login and password is going to work for the entire hospital. Any user can use that the same login and password. But yes, one person may not know the answer to every question. So that's true. It could take a little bit longer.
Great. Thank you for the thorough answer. I don't see any other questions rolling in. Any other comments or insights about the virtual site visit?
This is Ginger. I think Randy and Stacy and I wanted to see if some of the folks that had done it, like Colorado or South Carolina, Vermont, Illinois, Michigan, Alabama. I know some of those folks are on the phone today or on the webinar today. If any of them could share some of their insights or their lessons learned, or even help answer the very first question, how long has it taken? So if we could open up mics for folks, if they either want to share their experience that way, or Gunnar, could we open up the chat if people wanted to comment?
Yeah, I can.
Unable to
I
go
can't do
through the mic?
microphones in a webinar format, but I'll go ahead and open up the chat for everybody.
Okay, thank you. So if any of those states want to share their experience and what they found, Stacy, want to hold some space too for you to comment on, because I know Vermont has had the opportunity to use this a little bit. What have you guys found?
Thank you, Ginger. Yeah, Linda actually initiated during our learning community working and doing the pilot of a VSV. And I've actually had the opportunity to do some of the follow-up, and related to some of the time commitment that you mentioned or that was asked about. It's hard to quantify because the hospital active participation part is in pieces, whereas the EHDI program staff might be working on things, reviewing things, compiling things, and kind of getting ready for that next step. How much time it takes each of the stakeholders is a little bit different. What I found myself, and I think I'm also speaking for the hospital representative, is by formally coming forward with this VSV structure and platform, my hospital person was able to get levels of leadership at her hospital to the table that we had been trying to get to the table for years, to really understand how in-depth and comprehensive a newborn hearing screening program is. And we have had more successful momentum of accomplishing change in our PDSA cycles than we have in years by having that formal structure of having all of these individuals that hadn't been to the table before come to the table, learn more about the program and really what their role is. We've had some already measurable positive outcomes very early on, and continue to check in with them throughout to just keeping that timeline after that summary of the things that we were going to work on. So we have found it very beneficial. Another way we have used some of the individual tools that Randy presented on that are available on the website is we had a statewide hospital meeting. And so we shared about various tools and this VSV platform that we would be rolling out to each of the hospitals over time. And we were able to pull some of those tools to kind of share a little bit on the front end to say, as Ginger likes to say, something you can implement next Tuesday. Here's a tool that's available that you can use to provide to families or to bring back to your staff and review your processes. And so we have found some good success with using those tools standalone across all of our hospitals for a very short-term item, as well as doing the full virtual site visit with about 2 of our hospitals so far. And our goal is to get to all of them over the next year or 2.
Excellent. Thank you for sharing, Stacy. A couple things have rolled in. One is Arlene Stradler-Brown in Colorado posted in the chat, I'm happy to share my experience. We find the VSV to be a wonderful, beneficial, ongoing project. And then there is also a question in the, a question that says, does it cost EHDI Programs anything to do the VSV project?
No, these materials were developed through the CARES Act funding and are available just at no cost at all to use them. And, just to expand on that just for a moment is we do have a recommended program that we think would be ideal for state EHDI programs to use to do a full site visit and a comprehensive site visit. But it's really, really important that we also convey that, the whole goal is to really establish a collaborative relationship with the hospital and to make sure that they are using best practices on babies and families in your state. And so you have the ability with all of these tools that we provide in the VSV toolbox to pick and choose things that work for you, that work best for you. You don't have to do every single thing. It's not required in order to do the VSV. You can do the first meeting. You can use the nurse manager worksheet to get to know your hospital and to help them in knowing what their protocols and practices are and how to organize their program. I mean, there's just so much that is available to you to develop this type of a relationship with hospitals. And in many states, EHDI programs really have not sat down at the table with the administration or with the upper level management at all to really inform them on the importance of their state program. And this gives them talking points. This gives you talking points, and this gives you all kinds of things that can be used that meet your needs. So I just wanted to throw that in as well.
Perfect.
So, Randy,
Thank you, Randy.
Ginger, I'm going to follow up on that. Let me give a second for interpreter change. I want to share that in our state, we started in the very southern part of the state with our rural hospitals doing the VSV. We introduced the nurse manager checklist as one of the activities, and we introduced it in perinatal 10, which is down by our friends down in Kentucky and Missouri. And I started getting calls from Chicagoland hospitals wanting copies of the nurse manager checklist. So we found that kind of the friendly competition between hospitals of, oh, you're using something we're not using, really played out without us doing a single thing. They talked to each other, they shared the resources, and we ended up having an extremely positive outcome just from the sharing of that one tool. And then some of those hospitals have gone on to want to work with us to do the whole VSV project. But that friendly competition isn't necessarily a bad thing. Also to Arlene's comment that in the chat, pardon me, just do a shout out. Arlene is presenting at the National EHDI meeting in March, a little bit on site visits. So I think she'd be a great person to talk to about her real world implementation of what she's done for this as well. But getting to pick and choose the different tools that are out there and then how they spread those to other states or other hospitals has been fantastic. Arlene made another comment that says VSVs to date, she's done 16. Woohoo! Way to go, Arlene. Number 2, approximately 1 hour to schedule, which includes the EHDI director, the parent, the pediatrician, and the audiologist. 3, interview format used to collect information, which takes 40 to 55 minutes. Number 4, report resources sent to each hospital within 2 weeks of VSV. Number 5, conducting 2-month going forward. And number 6, plans for QI project. So I think Arlene has some beautiful experience, and I'm looking forward to hearing from her in March. But I know Arlene is a great EHDI partner and believes in stealing shamelessly and sharing seamlessly. So I'm sure we could pick her brain even before that.
Excellent. Thank you, Ginger. Anything to add, Stacy? There's another question that's come in, but if you have something to add, please do so.
I think we can move on to the next question. Thank you.
Okay. The next question is the VSV only for hospital use?
We actually use the terminology throughout the program, birth facility. So it could be a midwife. It just could be anywhere that has, screens newborns, any facility. So just, yeah, not just hospitals.
Excellent. Anything else to add? Any like real world experience, Ginger and Stacy, on working with anybody, any other organizations besides hospitals?
Whoops.
There
This
you
is Ginger, and I think maybe the chat could jump in and help discuss this, but I think Randy and I and Stacy have talked quite a bit of how this is a wonderful bridge and a conversation starter when there are vendors in your birthing facilities to help bring alignment in practices, as well as to continue to send the message to the birthing hospital that they're still legally responsible even when they have a vendor in place. So let's use some beautiful tools to make sure we're doing best practices and that we are all on the same page and communicating. Just simply filling out that nurse manager worksheet by our vendor really got some great conversations going back with the birthing facility, whether that's a hospital or just a birth center or a midwife. It just started some great conversations there. Randy, do you want to comment about what you've heard so far about dealing with vendors that are in the facilities?
I just know, based on my experience with working with vendors and birth facilities, as the majority of time, the birth facility hands over the newborn hearing screening program to the vendor, and most often it's more common that they just sort of wipe their hands and say, oh, they're the professional, they know what they're doing, and we don't really have to be involved anymore. And what we found in a lot of cases that I've been involved in is that's not the case. The case is that the hospital is very, very important that they know what practices are being used by the outsourcing company, and they understand all of the elements and the practices beyond just the best practices, but just they're making sure and holding them accountable to provide best practices to babies and families. And the EHDI program is really in the ideal role to be able to provide these materials, these best practice materials, to both the outsourcing company and the hospital, and sit down at the table with them and say, okay, are we doing this? Here's our checklists. We now have these wonderful JCIH checklists that can be used as well, which are not included in the VSV, but Ginger can talk a little bit more about that. But all I'm saying is that it is very, very important that there is a collaboration between the birth facility, the EHDI program, and the outsourcing company to make sure that reporting is consistent, that screening is consistent, that all of the state guidelines are being used, and that everything is really transparent. So, yeah.
And then that nurse manager worksheet, and just very lightly peppered through things, there is reference to CMV. I know you guys have all heard there's going to be a CMV conference this October. We're getting to have it a year early. That's coming. So yeah, advertisement for that. If you haven't heard, October of 2023, the CMV conference is coming to Salt Lake City, Utah. So it would be fabulous to see folks there. But lightly peppered in the materials that I call the Randy trifecta are some references to CMV. And there were some great opportunities to talk to the hospitals about, does your vendor hand off to the appropriate people when CMV information dissemination or CMV screening is required? So that's just another way of how things all intersect. It all comes around.
Excellent. Thank you, Ginger. Stacy, it looked like you had some comments to add.
So in Vermont, we are very, very small. So I think our whole populace doesn't actually meet vendor number requirements. So we don't deal with vendors here, but your examples and points you were making in regards to that relationship actually reminded me of the facility that we're doing a site visit right now, where it is the professionals in the sleep lab and respiratory therapy who actually conduct the screening and oversee the newborn hearing screening program. But they are at the beeper beck and call, or have been, not anymore, because we've been doing VSV quality improvement. But what we were finding is that it was like Randy said, they were like, oh, they do the hearing screening and then we take care of everything else around mom and baby. And that disconnect was actually really affecting the quality of the newborn hearing screening program and the number of families going home without a hearing screening or the opportunity of a potential rescreen before discharge, as well as consistent messaging of what are the next steps. So the virtual site visit kind of brought that to those individuals were missing from the table. And so we have now brought them to the table, and they came to the statewide hospital meeting, and the nursing staff is taking the National Newborn Hearing Screening Training Curriculum, even though they're not doing point of screen, so that they have a broader understanding of what the hearing screening program is and what their role is in caring for mother, family, baby, and the success and outcome of the newborn hearing screening program.
Excellent. Thank you. Okay, I'm not seeing any other questions in the Q&A box or other comments in the chat. Are there any final remarks, Stacy, Randy, Ginger? Okay, Ginger, go ahead.
Yep, this is Ginger. Randy, can you, I'd like to present a challenge to all of my friends on this call. But first, before we do that, could you comment on, you've worked so hard about the continuing education credits that are around the NHSTC and keeping those going. Can you, I'm just going to get the shameless plug out there for the curriculum. It's updated and what's free CEUs are offered. Can you speak to that?
Yeah, we have, we offer 0.3 CEUs, 3 hours, and we offer them to audiology, so AAA, and then we also do NAP CEUs to the Neonatal Nurse Practitioner Association. So those can be applied for any nurse who needs CEUs, can use those NAP CEUs for their CEUs annual, to meet their annual needs. So yeah, we are, we'd like to add ASHA. We've also had a request for midwives. And Ginger, we have been talking to your early intervention program about implementing the newborn hearing screening training curriculum into the EHDI program and offering CEUs that way. So lots of things in the works.
This is Ginger. I just have had great luck with pushing that out there, especially when nursing or audiology licensure is due, to get them to view the NHSTC because it is free. And then I think that helps set the stage for the VSV, which is why I bring it up. But I would love to challenge all my friends on this call today. We all know that 2023 is going to end with us needing to write a competing grant, EHDI grant. So I look at that timeline for the whole year and I think about, well, what do I need to do to get ready for that? What do I need to do to keep my sanity at a really good level as I progress? So I'd like to challenge folks that in the next week or so, you consider doing the VSV or learning more about it. And what that would mean is between now and the EHDI conference, you would request the materials from Randy or through the VSV site. Even though a lot of it is online and open source, there are a few things that she would send you that you could request. Between now and the conference, you could read through that and you could review the video that you all watched today. Also, before the EHDI conference, you could kind of get in your head who one of your hospitals are that you've got a great relationship with that you could maybe pilot this project with. Then come to EHDI, let's have a chat. Let's sit in our presentations. Let's pick Arlene's brain and learn more about the VSV so that when you get back at the end of March and beginning of April, you could actually do a pilot project of the VSV and start to get some of the information back. And then you'd be beautifully suited as you go to write your grants for the future if you want to incorporate this. So that's just my thought process. That's just my challenge to each of you. Between now and the EHDI conference, request the materials, read through them, review the video, think about your super hospital, and then come to the EHDI conference and let's chat more about it and learn about everybody's real world experiences so that late spring, early summer, you could actually do your pilot. So Randy or Stacy, any other comments?
No, I think that's great advice. Really, yeah. Thank you, Ginger.
Well, Randy, I'd love to share with you the comment that came through chat from Gina Cooper. We've been shouting about the fantastic NHSTC from the rooftops for our partners. Just to plug that we've received requests for CEUs for certified nurse assistants, CNAs. CNAs are the primary screeners in many hospitals in Michigan. Thanks for an amazing resource. And then Stacy has put the web link. So if you guys can grab that.
That's that's actually the email.
I'm sorry.
That's okay. I just want to encourage everyone to please use the VSV email when reaching out for support and engagement and participation in the program.
I'm going to just add one more little plug if that's okay. Building upon what Ginger mentioned in terms of thinking about your competing grants that will be coming up late fall 2023. And, you know, telehealth and virtual services are not going anywhere. Even if the pandemic winds down, which sometimes it seems like it's going to, but, you know, keeps popping its ugly head back up. You know, being able to offer services virtually is not going anywhere anytime soon. And in looking at the Maternal and Child Health Bureau's blueprint for change that they've been pushing out pretty significantly recently, the VSV is in great alignment with the pillar of access to services. And so that would be a really great tie-in for your grant to demonstrate that you're keeping an eye on this blueprint for change and that you are looking at doing things that hit those four pillars of quality of life and well-being for the children and their families, access to services, financing of services, and then health equity, which also the VSV lends itself to very well. So I just wanted to add that additional plug in. Any last thoughts? Okay, I think you're on mute.
I just put the link to the webinar. I thought it would be a short little link, but you might be able to copy it and paste it, but it's on the VSV website on infanthearing.org.
Yeah, and actually we'll also post the Q&A portion that we've been doing after the recording. So all of it will be up there. Ginger, final comment?
I'm going to ask a favor. We do have EHDI chats next week for the EHDI coordinators, some of which are on here. Could you send us the link to the MCH Blueprint for Change so that we can share that with our friends?
You bet.
Thank you. I'm sure we could Google it, but just to make sure we got the right thing, I'll steal it from you.
You got it. I sent it out with the coordinator meeting stuff, but I will resend it just so it's on everybody's, bumps it up on their email.
Thank you.
Okay, I'm going to go ahead and end. Gunnar, if you'd end the recording and then we can all just leave. And everybody, thank you for joining us today. And let's go forward and do great things.
So Allison, it looks like Gunnar gave us a web link.
Recording stopped.
For each of us to fill out a survey.
Exactly. Thank you. Thank you, Gunnar.
Click that and do that now?
Yep. If you'll go ahead and just click the link in the chat to do the evaluation of the survey, that would be great. Thank you, everyone.